I'm Julie Kushner. I am State Senator for the 24th District and co-chair with the fabulous Representative Robin Porter of the Labor and Public Employees Committee. And I am calling this meeting to order. I want to welcome everyone who is here on this Zoom virtual meeting, and also those of you who are watching today. You know, it is our purpose to discuss and make recommendations for the legislature on how to address cancer in amongst firefighters. And you know, I think we have heard in the past from firefighters who have suffered from the impact of cancer in their lives. We know that cancer is a dominant illness suffered by firefighters, and I think our major focus and concern is how to address this for those who can't return to work because they're too sick pre-retirement. So the cancer study group that we have here is hoping that we will be in a position to make recommendations to the legislature. So I will ask my co-chair if she would like to make comments in our ranking.
Thank you, Senator Kushner, and I'll keep it brief because I would like us to get started on this important task force matter, but I do agree that we need to work diligently in the time that we have allotted to address this very crucial and critical issue for firefighters, our first responders. So thank you.
Thank you, Representative Porter. Representative Aurora, would you like to make opening comments?
Thank you. You know, in the interest of time, let's just get going. I think we got some good issues to discuss and find some strong recommendations here. Thank you.
Great, thank you. So the first item of business after welcome and remarks is the request for an extension. And we did receive a request for an extension of time to complete our report from Task Force member Rick Hart. And I want to entertain a motion to make that request of our leadership. The specific date is a request to extend until the start of session, which is February 9th, 2022. I want to support this request because I think we have a lot to cover still yet, and I think that this will provide us an opportunity to make some serious recommendations to the legislature. So I would like to ask for a motion to that effect.
So moved by Rick Porter.
And I heard a second by Rick Hart. Is there any discussion? Hearing none, then I would ask all those in favor of extending the deadline for this committee to February 9th, making that request to our legislative leadership. All those in favor, please say aye.
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 Any opposed? Any abstentions? Okay, it passes. So we will make that request to our leadership, and hopefully, and our clerk Devin will forward that immediately. And I am confident our leadership will want to give us that extra time. The next item on the agenda is discussion of the issues, and I do want to point out that you should all received several items that we circulated through our clerk. There were two submissions by attorneys Drapo and Morrissey. One is a brief summary of possibilities for approaching the issue of the Firefighters Cancer Relief Fund. Some further information from them about the issue of presumption in workers' compensation. An issues list from Bill Adamson. And also from Bill Adamson is a pretty extensive report called the Lavender Ribbon Report, which is, it documents best practices for preventing firefighter cancer. And then notes that were forwarded and some comments from Representative Aurora. So I do want to say we appreciate all of this. It's been circulated, and some of you just got some of these documents yesterday, so we won't go over them in detail today. But I did want to suggest that before our next meeting, everyone has a chance to look at them and take, incorporate them into your own views, and we'll be able to have, I think, a good discussion, maybe focused on some of the aspects of the report that we want to highlight and possible solutions. I also had a suggestion from some that we invite others to come and present to us, which I think is customary, and it's a great idea. So we have had some suggestions for persons who are impacted, families where a firefighter suffered from cancer and was unable to return to work, and what the impact, and was too young or didn't have enough service to retire, and what the impact was on that person or that family. And another suggestion was to invite some organizations that have been dealing with these issues. So if you have specific people that you want to suggest or topics that you want to suggest for our next meeting or future meetings, again, I would encourage you to forward those to Devin. And if you want to take a couple of minutes to discuss that, the floor is yours. The floor is open for discussion. Do you think that's a good idea?
Yeah, I do,
I
Julia,
do.
our senator. It would drive home the need for the legislation to move forward.
Anyone else? Go ahead, Representative Aurora.
Yeah, thank you, Madam Chair. I think we have a lot of important discussions here, so I think we should allocate our time well. So while I do believe that we should ensure we hear from others, but to some extent we know that we all agree that we need to provide some of these benefits which are not, especially because of the funding concerns in the current law, will not be available. So given that we have to, conclude some set of recommendations by February, in the next 4 or 5 weeks, and I'm assuming we'll meet a couple of times, so maybe a few more times, I think we should allocate our time well, so that we have some time to go through any of the ideas which are suggested. If we need more expert advice on that, we solicit that. So in the interest of time, I would suggest that some of these additional hearings, we should constrain them by time. Thank you, Madam Chair.
Thank you. Does anyone else want to weigh in on this?
It seems like funding is the main hurdle. And I think once we figure that out, a lot of the other issues will kind of fall into place. If anybody can bring in someone that can help us figure out the funding problem, I think that would be helpful.
I agree. I think that that is sort of the bottom line issue for us. And I think that we have to look at very specific ways we can get a better handle on what could the potential costs be. So given what we've heard, I think that we can accommodate both the concern about having some input from those who are impacted, as well as being mindful, as Representative Aurora suggested, of the time limits, and make sure that the major focus is on discussion of the issues and finding solutions. So we'll work on an agenda for the next meeting that attempts to accomplish both of those. There was a suggestion we also got toward your concern, Mr. And am I saying your name properly, Drapeau?
Yeah, Drapeau or Drapeau is fine, either way. Yeah.
Okay. I think that one of the things we ought to consider as a recommendation is a real study, commission of a real actuarial study that would project what the potential cost is. I'm not sure there's anyone who could come in and, we might find someone on a national level who could give us some data about other states, but I don't know that there's been an actual study or a recent study of what the potential cost would be here in Connecticut. And I think that would really help advise us on how to proceed. So even if that isn't a suggestion that's exclusive to making suggestions. I think we can also make suggestions, but ultimately we are going to have to consider the cost. And so I think getting a better handle on that would be helpful.
There was a study done by NCCI, even though they said they couldn't project anything, that was utilized in Arizona because they went to a non-rebuttable approach. And depending on the assumptions on coverage, post work and what have you, that showed the cost could be as much as 225%. The filing that was just approved in Arizona to cover it, at least first step, is a 98% increase in premium, which is very costly. So for right now, some of my clients currently pay about $4,000 per firefighter for their coverage. And, under that scenario, that would double.
So maybe we could ask our John Moran from our Office of Legislative Research to look into that Arizona, the NCCI study and how it was utilized in Arizona. So, and if there's any other studies that are out there.
Sure.
Okay, thank you. Any other comments at this point on the discussion of the issues?
Madam Chair, if
I just want to.
that,
I'm sorry, I had my hand raised, but I don't think that Senator Kushner thinks.
I didn't see it. Yes, let me call my
That's
Senator.
fine.
Representative
Yeah.
Porter and Representative Aurora.
Thank you. I just want, I know that the funding is critical. That is like the elephant in the room, so to speak. But I do believe that we need to assess what our solutions, alternatives are, and bridging this gap and getting the firefighters the cancer relief that they need and deserve. That way we'll have a better frame of what funding looks like, what we're going to need, because that's going to be key too. It's not just a matter of the resource funding, but what amount are we talking, especially after what Mr. Adamson just stated. We need to take a look at, what we're suggesting and what it's going to cost us. And then we cross the bridge around funding and where we look to get it from. So I just wanted to put that out there. I don't want us to, not really concentrate on what it is we're trying to do because of funding, right? Let's do it in lockstep. And I just wanted to put that on the record. Thank you.
Thank you. Representative Aurora.
Yeah, no, I would want to build upon what Representative Porter just mentioned. I think that's right. First, we got to figure out what do we need to fund, or what is the cost, and how do we kind of define some kind of heuristics or rules as to what we're going to fund? Because if we look at 1601, there is clarity as to what they want to fund, or what the legislator intended to fund. That's one milestone. Or if we are agreeable with that, now I think there are concerns that it doesn't cover some, because what 1601 appears to be doing is replicating what a worker comp would fund if something like this were to be covered in workers' comp. Because it has a 2-year limit, it has a same kind of $1,300 or per week max, which is about the workers' comp max. And so one of the confusions or concerns which we've had, or at least I had in the last discussion, was, is this kind of, can somebody get both? Because under the entire cost for something like this, if somebody took this for 2 years, was $130,000. So obviously there was a clarification within 1601 that one could only apply for one or the other. And that was also, there was an assumption that this would be funded. So I think that clarification or that clarity is needed upfront, that is the benefit under 1601, is that what we are seeking for? Is that change in benefit, whether it be a survivor benefit, because there was no survivor benefit under 1601. Because once we decide that, then perhaps OLR or somebody else can help us quantify the cost of that, either in an insured way or in a self-insured way. Thank you, Madam Chair.
Thank you. I see Rick Hart has his hand up.
Thank you, Senator. As far as funding, On the career side, you have people that are in either a pension plan or a 401k that is already being funded by the municipality. All we're looking for is those benefits to be available at an earlier time frame than if their retirement eligibility is 25 years and they only do 20 years. All we're looking for is the benefit to be paid 5 years earlier. So that really the funding source is already there, so we don't have to worry about that.
Thank you. I think that's an important point. As I understand it, we are looking at specifically a group of firefighters who have cancer, cannot return to work, but are not yet eligible for retirement. So I think that, and we can look at what was done in other states. I don't know if that was the same issue they were trying to resolve, say in Arizona. But I do know that this is a limited group of people based on the fact that we're talking about folks who have served as firefighters but don't have enough time in to qualify for the pension. And I think that will help us sort of narrow the group. I see that raised some hands.
Yep.
Hold on a second, Vaughn. I saw Bill Adamson, and then I'll go to Vaughn Dumas. You may not all be able to see each other's hands the way I do, but go
okay.
ahead.
Yeah, I was just going to comment that that difference between retirement age and point when someone's injured and cannot work in Florida, as I mentioned last meeting, they deal it with a long-term disability policy. I found out that the cost of the long-term disability policy is only $41 per firefighter. It pays up to a maximum of $7,000 monthly, and there's a 90-day waiting period, and it carries up until retirement age. So that would be income replacement, and someone wouldn't have to take their pension early, in that pension, if it's a 401k, would be still allowed to grow to normal retirement age. I was surprised that it was actually so low. A lot of competition for these.
Sorry, the cost per firefighter again, it muffled out.
$41.
For 90-day waiting period, and the maximum payout was what per month?
Up to $7,000 a month.
That's really helpful to know. And I think, these are all different approaches that we want to take into consideration. I saw Vaughn Dumas, you had your hand up, Mr. Dumas.
Yeah, with respect to Rick Hart's commentary about the career firefighters, let's not forget the volunteers who don't have those contracts and those contractual payments. Having come from a union environment in my prior life, I believe most contracts or negotiated contracts have a line of duty clause for early retirement. I think maybe where the focus might be would be 401k. And I mean, Rick can probably chime in and correct me if I'm wrong, but he's still in that union environment. But we had a line of duty injury that allowed for early retirement, early pension if you got injured while you're working. I'm not sure that works the same way with a 401k investment.
I will ask if Rick wants to respond to that. Well, Rick is still working, so he may be on a call. But we certainly will make note of that question. And Mr. Dumas,
Madam Chair.
Hold on one second, Representative Moore. While we were talking about last time, we did have a discussion about as an administrator of this benefit, you had talked about you were close to having an application form ready, and I think it would help guide us if you could forward that application form, even if it's not final, even if it's just in draft form, if you could circulate, give that to Devin, and then we can circulate to the committee so we can have a sense of what will happen on January 1 when this program goes live.
So the form is going to be the form that is currently in use by the Connecticut State Firefighters Association to request benefits. The form that needs to be standardized across the state would be the exposure reporting form. because there are 3 or 4 different ones that are out there. So we'd have to standardize that. There's one that the UPFFA uses. There's one that the Connecticut State Fire Association uses. There's one that other unions use. So we need to standardize that and document that properly on the exposure side. And that would be a firefighter who is engaged in firefighting activities, goes into a structural firefighter, a fire incident, and is exposed. And it's a reporting form that you can document that, okay, back in 2019, firefighter A entered this environment that was hazardous, and we can pull that form back and show all the exposures that this individual firefighter has had throughout his career or tenure in a volunteer fire service.
So if you can get those forms, even the one that is already in use, and then the exposure reporting forms that need to be standardized, you said there are 3 or 4, whatever you have, if you could get that to Devin, it'll give our task force a better idea, I think, of what a firefighter needs to report on. And then does your organization have any kind of material that is given to the firefighter either before they apply or after they apply that outlines what the potential benefit is?
The current cancer benefit, no. We'd have to develop a flyer for that. That would have to be across the organizations and the fire service to do and put that work together to do that. And I can do that with the cancer subcommittee of the CSFA. I'll reach out to them because that's representative of each of those organizations, the chiefs, the fire marshals, CSFA, and we'll get a flyer that's standardized across the board for all the associations in the state.
I would think that would be important since this is really upon us. And, again, it would help us as a task force to understand, it would be sort of a documentation of what the existing understanding is about what the statute requires starting January 1, 2022. And that would be a good starting point for our task force to take from. And I think everyone, it appears to me from our previous discussion that people are aware that what was enacted and is now going into effect in just less than 2 weeks, might not be sufficient or might have flaws that we want to fix legislatively. But I think it would help if we know where the starting point is.
All right. Okay. I have notes to take care of that within the next week.
Thank you. Thank you. Representative Aurora.
Yeah, Madam Chair, my question is a follow-up question, perhaps to just the discussion you're having. That under the current law, which takes effect January 1, the approval of the benefits, so as to say, now funding being another point, the approval is going to be based on that form, or is both going to be based upon that subcommittee? So will the subcommittee have that responsibility to say yay or nay? Because the question would be, a firefighter basically applies for the benefits, and there is obviously the concern to approve whether they are indeed work-related or not. And is that a correct impression I have, that subcommittee in perpetuity will be the deciding authority?
The subcommittee has been charged with vetting all the applications and verifying the validity of the application by contacting the chief, getting the medical records from the doctor, the career tenure, and submitting. Once all that is found to be in order and correct, it is submitted to the treasurer of the Connecticut State Firefighters Association to submit to the state for authorization to release the funds to that individual.
I see.
Let me just ask a follow-up on that. I think probably Representative would ask this too. Who is it submitted to, and what state agency is it submitted to?
It's being vetted through the Connecticut State Firefighters Association. And through that, there's a subcommittee, a cancer subcommittee, because there is legislation already in place that permits the Connecticut State Firefighters Association to apply for state funding to be released to firefighters for injury and line of duty death, such forth.
So I understood that part, and I'm assuming that when you said that then after the approval from and verification, after the verification by your organization, then it's submitted to the state. And am I right to assume that it's submitted to the treasurer's? Is it through the treasurer's office, or is there another agency?
It would go through the treasurer's office. office.
That's what I figured, but I want to make sure we were correct. I know, I assume that because one of the aspects of the statute is that the treasurer's office is supposed to be making annual or regular reports, and that would suggest that they will release the funds after receiving verification from your organization. It doesn't, to your question, Representative Aurora, it doesn't appear that the state has some other authority that then reviews and approves or disapproves, or approves or rejects an application. That process of approving or rejecting the application, as I understand it, is within the State Firefighters Association. Is that correct?
Yeah, Vaughn, I think that's a question for you. Yeah.
Yes, that's correct. It's that was agreed upon back when this legislation was put together. There was some, it was some challenges to get to that point because so many associations are involved, but because of the legislation already in place, we didn't want to have to go through that process of how to apply and how do we get funds back out of the state.
Yeah, but that's Madam Chair, may I speak here?
Sure.
Yeah, because that's there appears to be a conflict there, and I'm assuming that was well discussed during the last legislation. I was not in the room at that time, because we know that about 30% of all cancers in firefighters are work-related, which implies 70% are not. So whenever you get an application, 3 out of 10 times you should be approving it in general terms over a long period of time. And 7 out of 10 times, you would have to determine that they are really not work-related because that's what the data overall shows. Now, from a firefighter association to basically say no 7 out of 10 times, I just think there's a lot of conflict involved here to be able to say no 7 out of 10 times and then obviously pick the 3 times, which obviously is most work-related. And so I'm assuming there were a lot of discussions which went through, and I don't know, Madam Chair, whether you want to discuss that more or because that was already discussed and approved in the last legislation, we're going to only focus on how to fund it. But that does pose a very significant, as I would say, conflict of interest from approval point of view.
I do think at this moment, to keep our discussion and our process moving, is probably better to look at various solutions and identity. I don't think that we can just say studies show that 30% versus 70%. We know that these are difficult. It's difficult to identify getting cancer in the workplace, just like so many other workplace diseases. It's very hard to prove, but yet there's a very high incidence of cancer among firefighters. So I don't know that we're in a position in this conversation to provide all that documentation. I agree with Mr. Dumas. I believe that was the process, and I know Rick Hart would speak up if there was a different process, but I don't think we need to relitigate what we did. I think what we need to do is look forward to what is the best solution. We have firefighters, the problem we're trying to solve is we have firefighters who contract cancer, who cannot return to work, who are ineligible for their pension, and that leaves the firefighter and the family without resources, whether it's income or healthcare, insurance. It's not what we as a state want for our firefighters, and so I think that's the problem we're trying to resolve, and we should be looking forward. If we get to the point of legislation for any of the recommendations, certainly there will be an opportunity for public hearing and for expert witnesses. So I think we'll have that opportunity in the future. I do see that Rick Hart has his hand up now.
Yes, thank you, Senator. To alleviate Representative Aurora's misgivings, it was a bipartisan agreement, with Republicans and Democrats to do this in the best way possible. And we also have to remember that the CSFA is the stewards of the money that is in that account. And unfortunately, the caveat within available appropriations is in the legislation or in the statute as well. So they're not going to frivolously award these benefits, because what if you're the next person in line and there's no funds there because they were reckless and careless in their deliberations. So it is something that is going to be watched very carefully by everyone, and hopefully that will ease your fears.
Thank you. Thank you, Rick. And I do think that one other thing we recognize, we have $800,000 allocated, and that's not nearly enough money to really accomplish, to really serve everyone who will be in this situation. And so I think really what we need to focus on are what are some alternatives going forward, whether it's additional funding or purchasing of policies or requirements on the fire departments. I think there have been a lot of suggestions made. Rebuttable presumption is a suggestion that was made. So there are a number of suggestions that have been made, and I think it's our job to sort them out. So again, I would encourage everyone to read what's already been circulated by some of the members of the task force, and I'm sure we'll be getting in other thoughts and recommendations over the coming weeks. Is there anyone else who would like to weigh in on this? Representative Porter?
I just really wanted to go back and I know that this was, part of the discussion when prior legislation was done, but I think one thing that we need to be mindful of is that, there are studies that have shown that firefighters have higher rates of certain types of cancer than the general population in the United States. So I think we should also be taking a look at, what kind of cancer-related deaths and occurrences are specific, that we find specific to firefighters. I know some of them have been reported to be like digestive, oral, respiratory, urinary cancers. So I think we need to take a look at that as well in order to help balance the concern around what Representative Aurora is expressing, so that we're taking care of the firefighters according to work-related cancer best we can.
Thank you, Representative Porter. And I know I would like, I guess this is maybe a little bit unprepared, but I know that I do want to suggest that Attorney Derpo, you actually presented some, I think, good focus in the submission you made with
Excuse me.
and I wondered if you want to address sort of some of the thoughts that you had that you put forward there.
Yeah, and thank you. And I'm going to start with the statute as it exists, not the workers' comp statute, the cancer relief statute, because it's my understanding that one of the purposes of that statute is to remove that very difficult question of whether in an individual case the cancer was work-related, and that it would seem like the committee who is tasked with deciding whether a firefighter qualifies for those benefits is simply going down the checklist that's in the statute to see if that particular application qualifies. In other words, do they have a diagnosis of one of the cancers listed in the statute? Are they a non-smoker, and so forth? So, and the trade-off is the benefits are limited. They're capped at 2 years. And so while there may be firefighters who are getting benefits whose cancer may not be work-related, the statute's designed to try to, with minimal administration, get immediate relief to the firefighters who are most likely to have a work-related cancer without having to get into that question. And to me, I see that instead of an either-or situation where you either elect the cancer relief fund or workers' comp, to me, they seem to work kind of hand in glove, where the cancer relief fund provides immediate assistance, but the assistance is capped and is limited. And and it allows someone to pursue the workers' comp claim if they want. But as I discussed at the last meeting, these cases have protracted litigation. They just do. They all do. No one files a cancer claim and then the employer says, okay, we'll pay it. I've never seen that in my 30 years of practice. So to me, it does work hand in glove. And if they are able to obtain workers' comp benefits, then the Cancer Relief Fund should get paid back for what they've paid, for those 2 years. And that's my view.
I appreciate that, and that's what I was picking up on in what you circulated. The other issue that has come up, which I think it would be helpful for our group to hear from you on, is how a rebuttable presumption would also aid this process of pursuing workers' comp.
Yeah, and as I try to explain, the typical process is you can't use the epidemiology, unfortunately, to prove an individual case because cancer is just too prevalent. You really are going to have to show what carcinogens they were exposed to, the frequency, the intensity, the duration, bring that to an expert and have the expert comment on it. And then, of course, the respondents are going to get their own expert, right? If we have a rebuttable presumption, then it speeds up the process. Now we've gone to the point where the respondents need to get an expert, and it speeds up the process quite a bit. So it really does cut down on the amount of litigation. And we also, to me, it's if they qualify for the Cancer Relief Fund, they would qualify for the presumption. We keep it simple.
Madam Chair, may I ask a question here?
Certainly.
Yeah, so the concern about or the question of rebuttable presumption is for the workers' compensation case, not for the allocation or the approval of the funds under the Cancer Relief Fund, because that's in any case goes through this subcommittee. So what we are saying, we're talking two things, and both relevant in certain way, but unconnected in some way. That what we're saying is the first element is how do we solve the funding need, and I pointed out to the process of allocating money under or awarding monies and benefits under the fund we are talking about under 1601. And what you're suggesting is basically perhaps even under workers' compensation, we need to change certain kind of the assumption there, so that the worker compensation litigation is more to the one favor on one or the other, or is faster in any case. Is that the discussion? Is that right am I correct in my assumption? That's what we're talking about.
Let me respond to that, because I think what we're discussing is what is the best way to solve the problem, which is we have firefighters who get cancer, can't work, and their families suffer greatly, they and their families. And so I don't think it's out of order for us to look at both the existing statutory requirements of a fund, but also seeing that I think we all acknowledge that's not going to go very far to solving the problem. So we're looking at what recommendations do we have to make for a complete solution. And so I think in that sense, it's appropriate and actually quite necessary to talk about workers' compensation as well.
Yeah, Madam Chair, I think that in that case, we also have to discuss kind of the pros and cons of each thing, because what we heard from Mr. Adamson is that changes on the worker compensation where it would lead to more, awards under the worker compensation could lead to some unreasonable increase in the worker compensation insurance cost. I think he mentioned the number 90%. So realizing that overall Connecticut businesses spend about $600 or $700 million buying worker compensation insurance, I hope we're not talking about that kind of 98% increase, or even I'm assuming that 98% is only on the fire agencies or firefighting agencies. So I think those two are connected. Every solution which we have to discuss we'll have to discuss with every single to 360-degree who's going to impact, who it's not. So that's from a worker comp, that becomes a very tricky, difficult issue very quickly. Whereas on the other side, if we focus on the the cancer fund itself, I would think, there might be some, I wouldn't say easy, but there might be some solutions, because I fully agree. Our objective is to provide the necessary and the required aid to the firefighters.
Thank you. Are there any other comments at this time? Mr. Drapeau?
Yeah, and I would agree with that, but we're also trying to find a way to get the firefighters the relief they need and to find a way to spread the cost. We have other social systems in place, there's private systems in place. And I don't think, the state needs to bear the entire cost. There are other ways to share the cost. For example, municipalities are already providing health insurance, right? For firefighters.
I think that, but I think that's, yes, my understanding is municipalities are providing health insurance, but it's also my understanding, and someone here can probably confirm, that when a firefighter is unable to continue working and doesn't qualify for retirement, that at some point they lose their health insurance. If they die, their family lose the health insurance. And I think those are some of the concerns that I've heard testimony on. And I think that's why it is a bigger problem than just a short-term bridge, a short-term issue of the 2 years that is capped under the firefighters fund that we currently have. I see.
I can just comment.
You can in a minute. I'll call on you in one moment, but I did see a hand from Rick Hart.
Yes, Senator, you're correct in the fact that if a firefighter doesn't hit retirement eligibility, they lose their health benefits. So that's one of the key factors that we need to look at.
Thank you. And Mr. Dumas?
You're kind of focused on municipalities and career firefighters having health benefits. Volunteer firefighters do not have health benefits from their municipalities.
Thank you. It's important to keep that in mind. And I do appreciate that, our intention is to also make sure that we're addressing the needs of the volunteer firefighters. Any other comments at this time?
Madam Chair, I want to make one kind of clarification for all of us, that there is only two sources of money we're talking about here. There's no third source. There is no individual who's going to contribute. It's either going to come to the state's coffers or state appropriations, or it's going to come through municipalities through increased amount of payments, either for workers' comp funds or direct payments. So we need to, I think it's for all of us here on this committee, we need to be clear. Those are the two areas where this money is going to come from. And to the extent that perhaps our job here is to decide how much money is more important, because either one of us of the sources is our source, or is a tough source in some perspective. If there is a third source of money, I would love to hear, because when you peel the onion, I don't think we're going to go, you could say that the taxes of the state are actually coming from all individuals or so on and so forth, but that's going a little too far. But if there's a third source of insurance or something, maybe I'm not thinking through it. I would love the enlightenment there. But my perception, either we're going to ask the municipalities to pay for it through increased insurance or some other way, or we're going to basically cut them a check through an appropriation method, which we might ask the legislator to do through our recommendations.
Thank you, Representative Aurora. And I think we're all aware of the sources of funding, and if and when we have legislation, there will be, I'm sure, a thorough vetting of any proposal that we make and the cost to municipalities and to the state. I think our responsibility here is to come up with what we think are the best solutions, and it may be that we'll look at an array of solutions. But I think there's no question that as a society, we have a responsibility to care for those who serve our communities, and firefighters are at the top of, first responders are at the top of the list when we address this issue from the perspective of the state or the municipalities. And so I think what we're doing here is trying to find the best way to address the issue. So any other comments or questions? If not, then I think I'll move to the next item on the agenda, which at this time, I find my agenda buried here under all of the numbers. The next item on the agenda is to talk about next steps. And as we suggested, if the next meeting, if the extension is approved as we anticipate, then we would suggest that we have at least that we schedule and that we plan for the following dates for meetings, that we would meet every 2 weeks. So that would put our next meeting on January 4th, then followed by a meeting on January 18th and a meeting on February 1st. I think for planning purposes, it would be good if we could secure those dates, the same time of day, 12 to 2, that we would ask task force members to hold. And during that time, we would maybe focus on bringing in some folks that can present on some of these issues that we've already discussed. We would encourage task force members to forward other solutions, other ideas, any recommendations for presenters, and to do so as quickly as possible so we can start scheduling those through the month of January, with the goal of having a report and recommendations no later than February 9th. And, it may be necessary, and I would just ask that folks look at the 8th as a possible date where we might need to vote on a report and recommendation. So if that is acceptable to folks, we will, block that out in the calendar, and our clerk will keep you posted and send out the Zoom links.
Madam Chair, I would like to add another additional next step as well, if you would allow me to.
You're always free to say whatever you think appropriate, Representative Aurora.
Oh, thank you. You're very kind, Madam Chair. What I think to solve, in the interest of solving the problem, I think we need to ask the OLR to basically provide us as to how much money, if we were to basically fully fund this, would be required on an annual basis. Because as I said, the question is, we can fund this 2 ways. And the most important thing is to know how much money is needed, because otherwise we'll never make a real step to solving this problem. So if we could have the OLR give us 2 numbers. One is, if we were as a legislative body to fund these benefits, how much appropriation we would need per year. And second, if we were asked to ask the municipalities to pay through an extension in workers' compensation, how much money would per firefighter each municipality would have to pay additionally for each municipal firefighter, for each firefighter? Because I'm sure if we refund them that money, they would have no problem with it. So we could split it with them. So I think if we could add those 2 items, I think those would be extremely helpful in coming to a solution and making some kind of a recommendation with the kind of understanding of what we are trying, how much money is involved.
And I just, before you, I see that John has his camera on and is ready to respond. I do want to point out that I believe representatives can always ask OLR, OFA for information. That's one of the things that we're allowed. I'm not sure if this would rest with OLR or OFA, but I think one of the problems is I'm not sure we have an actuarial study that would help us really assess that accurately. But John, you're the expert. Tell us what you think.
Thank you, Madam Chair. I was going to say, Representative, that the number is figuring out the cost of something, that is OFA's job. So that wouldn't be us, but I think they would look at, one of the things they might look at is whatever the last bill we had. I think there were some bills on this that wanted to just, we go back, it might be back to 2016 or 2015, when we had bills that just straight up added firefighter cancer benefits to the workers' comp system. We could see if the bill came to the floor, OFA would have had to have done a note, a fiscal note estimating the cost then. Now, that would be a few years old, but you could also ask OFA now to do something. Any legislator could do that. They do tend to only do notes for bills because they have so many to do. If there's every single question about, you know, a hypothetical, if you will, then they could just be generating a lot of hypothetical numbers. But that, I'll leave that to them. You can always ask them and they can, you know, provide an answer. I don't want to speak for OFA. But we could at least certainly look back at the bills that were done before. I'm pretty sure we had bills that called for adding the firefighters' cancer benefits to workers' comp. We could see what that would have cost. The bill would say how much of the cost would go to be on the towns and how much would be on the state. Probably most of those bills would have put the cost on the towns because the towns primarily provide the workers' comp benefits for firefighters. State has a few firefighters at Bradley Airport, I believe, but the state doesn't have any firefighters.
Madam Chair, through you, the reason I asked it of OLR is because this is a question from an analysis point as to what would an agency which is not the state exchequer, right? It would not, just as you mentioned, there might be a small indirect cost to the state, but this is likely, if we go the worker comp route, cost to other agencies or other municipalities, which I think when we consider the OFA analysis of any bill, we basically come to the point as to how much it costs us and how much do we have to appropriate for it as a body. So, but my question would be if an analysis could be done either by polling insurance, people who provide that insurance, as to how much more would they have to pay, because Mr. Adamson pointed out that there was a 98%, and that number is just really jars me because suddenly it makes it extremely difficult, and then that makes me want to look at a different solution. And I'm assuming for all of us, we would be focused to look on a different solution if the numbers Mr. Adamson saying are in the ballpark. So that's, in some sense, I'm kind of requesting yourself or the OLR to kind of really run that area of analysis, which Mr. Adamson has pointed out, that is that true, that should we basically put it on workers' comp, there would be that order of magnitude a cost on our municipalities.
Mr. Moran, would you like to respond?
Did you call me?
You're muted, yes. No,
Yeah.
Mr. Moran,
I wanted to point out.
Bill?
Yeah.
I was just going to ask John to respond to
Oh,
Harry,
okay, sorry.
and then I'll come to you, Bill. Go ahead.
Madam Chair and Representative Aurora, the OFA notes do look at the municipal impact too. That is part of their duty. So it would say what the municipal cost is. That is a routine part of they always look at the public cost, whether it's the public cost for the state, you would say what the state impact is, and they would say what the municipal impact is. So that would be included in that. I'm going to see if I can search and find something now from back in 2025, 2014, around that era.
Thank you, John. And
Thank
if you, excuse me, if you, anything you get, I think you understand, to send to our clerk and he will circulate amongst the members of the task force. I did want to call on Mr. Adamson. Bill, do you have a comment?
Yeah, I wanted to point out a couple things. Number one, if you think about when I mentioned that in Arizona, that was a 98% increase, basically that says the cost of cancer is the same as providing all the other comp benefits for all other injuries. It's a very expensive method. And the reason is because a comp insurer, if cancer happens during the policy year, you have that cancer for as long as there is cancer. Versus on healthcare, for example, they pay during that policy year all the medical benefits, and then if they're no longer the carrier, next year is paid by the new health carrier. So, for example, we have a case where a cancer victim came out of remission and now needs some expensive drugs at $15,000 a month. And we have now to pay $15 a month, as long as we can keep it at 15 for life. Being able to predict cancer cases out 7 to 10 years with technology change and everything else is very difficult. That's why the cancer rates for comp have to reflect the fact that there's this massive unknown and volatility versus a health insurer can rate every year and say, hey, we had these amount of losses, we want this amount of rate, and there are restrictions on it, but normally they're able to rate reasonably for that increase. That's why in my issues list, I tried to list the benefits that come from cancer that firefighters should be thinking about, the medical, deductibles, copay, time off for sickness rather than out of their sick days, disability payment, death benefits, and new one was mentioned today that I hadn't thought of was the continuation of medical coverage after someone is no longer able to work, and I know that is written into the Florida statute in their system. So there are ways to take care of this, and this is focused on career, not the volunteers. The volunteers, I think, is a much more difficult one to deal, but it's far less expensive than comp to do it utilizing these critical illness and other policies. And with the finite amount of money there is, I mean, I know in some states where comp has gone up because of presumption, and it's resulted in less benefits for firefighters, in cases layoffs, because there's just not enough tax dollars to go around. And also, then we haven't even touched on the fact that there's so much more that can be done on the prevention side, so people don't get cancer. So, I would just ask everybody to think long and hard about, okay, comp has been the one sort of this has been in for a long time. Comp provides a lot of benefits, but there are other ways to do this that are going to be much more beneficial, in my opinion, to firefighters, having watched this in other states. And I'm one of the few companies that writes in multiple states. And so I'm seeing it firsthand. It's sort of like deja vu all over again for some experiences I've had. And let's look, I know there's the funding in it, there's never enough money. So let's look at providing the broadest amount of benefits for firefighters that they deserve, along with the prevention activities. Well, that should be number one from my perspective.
Thank you, Mr. Adamson. And I think we probably can all agree on that. The last statement, which is prevention, is important, key, and obviously we would hope that any approaches toward prevention would be embraced by everyone. I think that's very likely. But even with those, forward-looking proposals to prevent cancer, we still have far too many firefighters that have already been exposed and that are now suffering, and we need to address the problem. So I think that basically we're in a position in this task force to look at a variety of solutions, and it could very well become a situation where we take several different approaches. So I think probably can't rule out workers' comp entirely, because I think that is one avenue and resource that is available that we would not want to prevent people from going to. And I think some of the ideas about how to extend a person their service credits, essentially, so that they qualify for a pension might be another solution that is appropriate in certain circumstances, so that it's time limited and then it takes over from the pension. Obviously, there's still cost to that, and no one would deny that in terms of the cost of the pension and the cost of the insurance. But there may be a set of solutions that will work well together to provide the lowest cost to the state and to the cities. So I think on that note, unless there are other comments, I would entertain a motion to adjourn, and we would then reconvene. We would meet again on January 4th. And
Second.
is there such a motion?
Yes, I propose the motion to adjourn.
And the
I
second?
second.
And let me just say thank you all for participating. I really do appreciate all the thoughtful contributions that have made both in the discussion, but also in the documents that you provided to us. We will continue to circulate anything we receive. And, it's a time of year where everyone's looking for a little rest and a little peace. So I want to wish you all a happy holiday season and good health. Be careful and be safe. Anyone else? Representative Porter?
Thank you. I will just, reiterate what you said. I'm very grateful for you all making the time, because I know we're all busy, and the fact that you made the time to be a part of this task force. I'm encouraged. I'm hopeful. I'm really looking forward to, coming to some viable solutions for these firefighters, our first responders, the ones that have been out there fighting the good fight from day one and still out there, risking their lives. I think this is something that is due to them, owed to them. And I have complete faith that we're going to come up with a solution that's going to work for everyone. So just thank you. And absolutely, for whatever holiday you've celebrated or are celebrating, I wish you a happy, and a merry. Be safe, be blessed. Thank you, Madam Chair.
Thank you, Representative Porter. Representative Aurora?
Merry Christmas and happy holidays to all.
All right. Thank you all. We'll see you after the New Year's.